But, okay, so can you explain a little bit, because there's a lot of viewers who want to get procedures done that absolutely have no idea even the difference between a Botox and a filler. They think it's the same thing.
Right.
I'm not a licensed doctor. You are. So could you explain what are the main questions you get from potential clients or clients, and what do you want people to mostly know about fillers and things like that?
That is a great question, because I think people are disillusioned. They think that, when they see someone, that they can just automatically achieve that look. And aesthetics is very different. It's not plastic surgery. You have to start the process, and it is a process. And the products do wear over time. And for your specific look, you should begin to learn what's going to help to make you look like that. Mm-hmm. So, I think that there are some procedures that have a specific look to them, like where, the BBL is so common now, and there's a specific shape that we're creating when we perform the procedure. But when you do Botox or fillers, when I first started doing it, one is I've been in the business for over 20 years. Secondly, there are patients used to come to me and bring me a picture. The number one picture that they would bring me.
Let me guess.
Let's see if you can guess.
Kim Kardashian.
Yeah. Yes. Who's number two? Her sister.
Khloe.
Yes. Very good.
I can't.
Did I tell you this already? No, I never told you this story.
No, tell me.
Literally, it was annoying. Like they would come in there like, that's what I want. Like I just put it in. I'm like, are you kidding me?
No.
Yes.
So, and I'm not.
This was a thing.
Yeah. I was a patient care coordinator in the actual plastic surgery business, and part of my job was managing realistic expectations with the patients, because I would get the same thing. I'm like, honey, it's not. It's an enhancement. It's not a total changing you, morphing you into someone. It's not that becomes.
Or you may actually never
the
look
movie.
like that.
Yeah. So that's probably. How hard is it for you to give clients politely, ethically realistic expectations as a professional?
Thank God for yourself, patients like you, my friends in the business, for putting myself out there publicly on social media on a daily basis and sharing, because it's created a trust between the patient and I. And now they know that I'm a listener. So I want to understand what your expectations are, and I will be very honest about whether or not I can meet them. And I'm also very honest about what your specific issues are and what your needs are. And so long gone the days where no one ever comes in with a picture anymore. And even if they did, I mean, for the most part, I do enjoy looking at pictures of a patient like 10 years ago and showing them how we can get closer to you when you were a little fuller or younger. Yes, more realistic. But those, it's, I feel like people have learned to move on from the trends, and now they're really starting to understand how the product works, which is more important.
Yeah. So, Dr. Bell.
Yes.
The main question I get in my DMs is, I need Botox. I need Botox right here. I need Botox. And I'm like, honey, you need fillers. And they're like, but people think Botox and fillers are the same thing. They're like, we know I'm not a doctor. I'm just a big patient of yours. Can you please explain to the audience what Botox is and what fillers are and what they look like, what they do, and what's the difference, please?
Absolutely. And it's very simple. So Botox is, the tox is short for a toxin, and it actually paralyzes muscle. So Botox is placed directly on a muscle. So when you study anatomy, you know where all those facial muscles are. You can actually stop them from moving. There are some like near the jawline, near your chin, specifically, of course, around the eyes, orbicularis oculi, oris. There are corrugators. You have the frontalis muscle. We have this mean muscle.
That's
here.
the 11s.
That glabella.
That's the most popular.
Yes. So we want to knock them out. You knock them out with Botox. All it does is minimizes movement. It helps to prevent the release of acetylcholine, and then the muscle cannot move over time. Guess what the best part about it is? What? It's preventative. So if you do a little bit over time, eventually it just softens, which is why you look so fabulous. You don't need a lot of anything. If not, I would need a lot of bottles of this and I'd be pouring them. We don't. Because
I need some right here, right now. Like,
it's okay. It's very little, Chrissy. Relax. But people don't always see themselves. So I help you to identify, where your stronger muscles are and relax them. So you wouldn't want to put filler here and make yourself a fat forehead,
no,
right? You want a fat lip. You don't want a fat forehead.
Exactly.
So you don't put this in your lip and you don't put this
so
on
what
your
is that?
forehead. So this is filler. So filler is placed, and this is just one brand. There are several. But fillers are placed in areas that you want to get some tightening, some extension. You want to add the hyaluronic acid that you're losing. So wherever you want to lift. So the most popular area now are lips and then, of course, cheeks. And that's not a muscle. Your lip itself is not a muscle. It's tissue, right? So you just want to expand the tissue and make it look fuller. Yes, we want that look. Yes.
I don't want that look. So I know also from coming to you that placement, because a lot of people, they just go to anywhere, these back room, somebody got their Juvederm girl, and they don't know where to place it. But what I learned coming to you is placement is very important. And that's why, everyone, it's important to go to a doctor, a professional, because it's not just filling in the lines around the puppet mouth. What's that called?
Your nasolabial lines.
The nasolabial lines. I call it puppet mouth.
Yes, it is.
But it's also about placement, because what I do when I normally get injected by Dr. Bell is she'll put, when she does my cheeks, she'll put some up in here. And what is that going to do? When she fills this up, it lifts a little subtle. It gives me a little bit of a facelift, and it pulls those wrinkles down by my mouth.
And you've lost the lift over time as you're aging. So gravity is pulling us this way, and if you do some maintenance, you're pulling yourself back up to where you were previously. So it's not as artificial. When you see people that look extreme, it's usually because they went a little too far and they asked for it. They requested that. It's not always because the injector uses too much product.
Do you know what I love about you, though?